Let's look at discrimination of healthcare services for inmates with a mental illness. Mental health is a worldwide issue, but did you know that more than 64% of local jail inmates, 56% of state prisoners, and 45% of federal prisoners have symptoms of a serious mental illness? Probably not, because I didn't either. Now this is a national tragedy, and these numbers are not in any way declining. In fact, in the past, the total number of prisoners with a mental illness was at about 20%. Now you can see that this problem today is about 2 to 3 times greater than anyone had ever imagined it to be. So what does this mean? This means that the mental health care system is failing long before people even enter the criminal justice system, while they're in it, and after they leave it. Mental health treatment isn't readily accessible for those suffering. Due to the declining number of hospitals and other mental health services for civilians, there has been an increase of seriously mental ill persons behind bars. The jail system is not set up to properly treat and diagnose these patients who have a mental illness. Doctor's appointments are not easily obtained for prisoners unless there is a life-threatening issue. And even then, they aren't as timely as they should be. Mentally ill people need hospital treatment, not jail time. Now, this doesn't mean that they shouldn't have to pay for the crimes that they have committed, because yes, they should. This just means that from being behind bars, forgotten about, and not getting the medication, psychiatric appointments, and evaluations that they need to be healthy, they have no shot at improving. Most people who are dealing with mental illnesses have conditions that are manageable. Up to 80% of people with mental illness improve with treatment. So why aren't we treating our inmates? We could reduce the number of incarcerations just simply by treating our mentally ill patients. Get this, it's proven that mentally ill inmates remain behind bars longer than other inmates. For example, in Florida's Orange County Jail, the average stay for all inmates is 26 days. Now for mentally ill, it's 51 days. Why is this happening? Well, it's because those with a mental illness are finding it difficult to understand and follow jail and prison rules. Without proper treatment and diagnoses, how do you suspect they will ever be able to abide by the rules of the law? Now, yes, there are guidelines in place for mental health in the criminal justice system, which include treatment for depression, bipolar disorder, schizophrenia, and chemical detoxification. But our issue here is that the person must be aware that they have a problem, and their problem must be documented for them to be able to obtain these services. Prisons and jails aren't screening, assessing, or evaluating every inmate that becomes incarcerated. And this right here is the problem. This is why so many cases of mental health aren't being recognized or treated. They're just being simply forgotten. Now, how can we change this? Well, Florida's 11th Circuit in Miami-Dade County has found a way. They have established a program that diverts people who have serious mental illnesses and substance abuse disorders, but who don't pose a threat to public safety, into community-based care instead of jails. As a result, they have been able to close an entire jail, saving taxpayers $12 million per year. The recidivism has dropped from 75% to 20%. This is incredible, and more counties should be paying attention to this tactic. Another solution is a new campaign that has been announced by the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Foundation. Stepping Up is a nationwide initiative with the goal of reducing the number of people with mental illness and substance abuse disorders in our jails. The initiative will challenge counties across the country to adopt meaningful reforms to increase access to treatment services and improve coordination between mental health agencies and the criminal justice system. Now, these efforts can help bring a change to discrimination of healthcare delivery services to non-traditional patients, especially those patients within the criminal justice system. They could reduce the number of people on the streets and incarcerated living with an untreated mental illness. We need the world to see that inmates, criminals, convicts, jailbirds, or whatever else people want to call them, are humans too. And when will being human be enough to receive the care that they deserve?
They're going to give her an injection.
Here, at Chicago's biggest jail, this mentally ill inmate did a front flip on her bed and refused her medication.
Come on, lay down on the bed.
Correction and medical staff moved in. They restrained her and gave her an injection.
This is something that happens all the time here, and at the heart of it is, we're not a mental health facility. These people should not be here.
Cook County Sheriff Tom Dart says it's just another day at his jail. This inmate burst out of his cell and somersaulted over the balcony. He hit the ground below and tried to break out of a secure area. This man attempted to break his bed.
These people, by and large, are not criminals. They're people with mental illness, but when they act out, they end up in the jails because it's the only place that will take them.
CBS News obtained records from police departments across the country, many in states that have made budget cuts to mental health care. Police logs in 12 cities revealed that mental health crisis calls have increased an average of 37.5% over the last 4 years. Los Angeles County Sheriff Lee Baca says more mentally ill people end up in jail when they're not getting the medications they need. Is that why the increase suddenly?
I believe it is. I think that medication is the stabilizer for most mentally ill people. The money for that dried up with our California economy going south. And when they go off their meds, then they go back to the behavior that leads to a law enforcement solution.
Was not the place for him to get the help that he needed.
Catherine Wooten of Los Angeles called 911 for help when her 23-year-old son Terrence suffered a mental breakdown in October of 2011.
The police came, and I thought that they were going to take him to the hospital, but he wound up in county jail.
Police tell us with few mental health beds available at state facilities, they have no choice but to leave the fate of people like Terrence Wooten to the criminal justice system.
They have a mental ward in county, but he wasn't really getting the counseling and the therapy that he needed.
You're not a psychiatrist, and that jail isn't a hospital.
I'm not a psychiatrist. The jail has become a hospital and a de facto way for the mentally ill. They do commit serious crimes. We don't deny that. What is the remedy? Is it purely a criminal justice remedy? I don't think so.
Now, the Department of Justice says up to 64% of inmates at local jails have some mental health problem. Using that DOJ statistic, the two largest jails in the United States, Cook County and LA County, would become two of the largest mental institutions in the country de facto.
Important story, John. Thanks very much.
Now we will take a look at discrimination of healthcare services for inmates with STDs. Jails are breeding grounds for high concentrations of infectious disease, including sexually transmitted diseases, or STDs. Many jails and prisons prioritize urgent health conditions such as mental illness, withdrawal from drugs, and tuberculosis, but STDs and other chronic conditions inmates have aren't always noticed or tended to. With the largest prison population in the world, it comes to no surprise that the United States has a major problem with STD testing and treatment within the correctional system. Jails and prisons are often used interchangeably, but there is distinct differences between the two that have a significant impact on the rates of STD infections in each. Jails typically hold inmates for a shorter amount of time, often less than 24 hours. Prisons, also known as penitentiaries, are long-term facilities for punishing criminals by housing them until their time is served, giving them time to rehabilitate before returning to society, preventing additional crime by getting them off the streets and discouraging future crimes. Inmates who are serving time in prison are more likely to receive medical treatment for some STDs due to their generally longer sentence. The Centers for Disease Control and Prevention, or CDC, published a study in 2011 evaluating the STD screening programs of large jails throughout the United States, which found that most jails don't have an adequate chlamydia screening program, despite the extremely high prevalence of chlamydia in the world. All 14 jails that were visited offered chlamydia testing at the inmate's request, but almost 1/3 of the jails only conducted testing on select inmates, chosen based on their age, gender, and criminal charges. Less than half of the jails offered comprehensive chlamydia testing, and among those jails, slightly more than half of the inmates who were tested positive for chlamydia received treatment. Rikers Island in New York was the only facility that had a comprehensive chlamydia testing program, but no formal follow-up process for inmates being released after being diagnosed with chlamydia. The high number of intravenous drug users entangled in the correctional system, practices like homemade tattooing, and consensual and non-consensual sex occurring between inmates create an environment that is conducive to spreading HIV and hepatitis C in jails and prisons. Most correctional institutes don't have the funding to offer access to the antiretroviral medications needed to treat HIV and maintain low viral loads, so they only provide a bare minimum of basic healthcare and nutrition. Many facilities also segregate HIV-positive inmates from the general population, which increases the likelihood of discrimination and abuse from other inmates and correctional officers.
More than 30 million men and women spend time in prisons each year. In many countries, AIDS is one of the leading causes of death in prisons, along with tuberculosis. Prisoners are 5 times more likely to be living with HIV than adults in the community.
We are the second in the whole world with the highest adult HIV prevalence of 25 as we speak. And amongst male inmates is now 31.4. Amongst women, it's quite high, 69%, and that is the biggest challenge we have insofar as women are concerned.
Prisoners are members of the society. They come from the society. They will return to it sooner or later. So we have to treat them as members of the society. And that means, of course, that we are not treating them in a substandard way, but treat them with the same treatment options as people outside.
Poor prison conditions increase the likelihood of infection with HIV, tuberculosis, and hepatitis B and C.
During the time I was in prison, I learned a lot. Prisons are characterized with overcrowding, coming with the other challenges such as sanitary facilities. Condoms are not made available to prisoners. This is because there is a belief this will encourage them to have sex. But then the question is, are they not having sex? Is sex not there? Responding to treatment, it goes with a good diet and so on.
Prisons are overcrowded in the majority of countries. Policymakers should have a close look at who is being held in prison, why they are there, and for how long they are being detained. Many prisoners continue to serve sentences for petty or non-violent offences. Many have also spent years awaiting trial. All of these factors affect the overall health of prisoners, including those with special needs. Other key populations, such as people who use drugs, sex workers, and, in some countries, transgender people and men who have sex with men, tend to be overrepresented among incarcerated populations. Most women in prisons are from socially marginalised groups. They are mostly serving short sentences for non-violent crimes. HIV rates among women in prisons are almost always higher than among men in prisons. Generally, there is a lack of access to healthcare in prisons. For women prisoners, the situation is even worse. HIV and reproductive healthcare services, including those dedicated to preventing mother-to-child transmission of HIV, are particularly limited in women's prisons.
They come here almost every day to receive their dose, and I'm happy also to report that there's quite some improvement on their health status.
Inmates, whether they enter the correctional system with STDs or contract them while on the inside, become a threat to public health once they are released. Therefore, STD screening and treatment of adults in jails might be an important way to affect STD rates in their communities. A study was conducted in a city in Atlanta, Georgia, which found a positive correlation between incarceration rates and STD rates in the general population. The number of partners, as well as contextual factors, may explain the increased rates of sexually transmitted diseases. High incarceration rates can disrupt existing sexual partnerships due to the removal of a large number of men from a neighborhood. In order to fulfill financial, emotional, or sexual needs, the partners who were left behind may engage in high-risk sexual relationships. The former inmates will return to the community having had multiple partners, putting both themselves and others at risk for acquiring diseases such as HIV. During these incarceration periods, men may also engage in same-sex sexual behaviors as well, further increasing their risk of STD transmission. Guilford Press explains that diagnosis and treatment of HIV in prisons can further public health goals of HIV control, prevention, and education. Routine HIV testing can be incorporated into primary and secondary prevention programs in correctional facilities. According to studies conducted by the CDC, two significant challenges when establishing routine STD screening programs within jails and prisons include completing priorities of security versus public health, as well as funding. According to this study, many sites mentioned concerns regarding difficulty in accessing medical records at the jail, difficulty in timely treatment of infected inmates prior to release from jail, lack of staffing, both screening and correctional staff, space availability for screening process, as well as other costs. While there are some clear barriers, several facilities have successfully established some elements of jail screening programs. These implementations include having an open line of communication between health and security staff, the development of innovative techniques to incorporate screening and testing into an existing jail's health program, so as to decrease the potential burden it may have on a facility, as well as building collaborative partnerships between potential stakeholders. As medical providers, it is crucial to determine and address the needs of patients despite possibly limited resources and time. Patients who are not aware of these health requirements are especially in need of these services in order to prevent the transmission of these infections both inside and outside of jail settings. The correctional system in the United States is already stretching budgets as thinly as possible, but without a bigger commitment to STD testing and STD reduction techniques on the inside, the prison STD epidemic may continue to be a part of reality that never really comes to an end.
Because substance misuse has traditionally been seen as a social or criminal problem, prevention services were not typically considered a responsibility of healthcare systems, making discrimination against patients with substance use disorders prevalent throughout the healthcare sector. It is known that most people with substance use disorders do not seek treatment on their own, many because they do not believe they need it or they are not ready for it, and others because they are not aware that treatment exists or even how to access it. But individuals with substance use disorders often do access the healthcare system for other reasons, including acute health problems like illness, injury, overdose, as well as chronic health conditions such as HIV/AIDS, heart disease, or depression. It is not confidentiality protections that undermine the message that addiction is a chronic medical illness. Rather, it is arresting, prosecuting, and incarcerating people because of their illness, and it is the lived experience of patients who face discrimination from their healthcare providers, insurers, and communities on the basis of their illness that actually weakens the perception of substance use disorder as a chronic disease. The confidentiality law is often the only shield between an individual in recovery from addiction and the many forms of discrimination and prejudice that could destroy their lives. Public stigma refers to the attitudes of the general public and to attitudes of subgroups, such as first responders or clergy, that may have norms that differ from the general public or other social groups. Public stigma persists in part because structural stigma in the form of laws, regulations, and policies appear to endorse prejudice and discrimination against people with behavioral health disorders. A recent systematic review identified 36 articles published over the last 25 years that reported on results from population-based studies of public stigma in the United States. These surveys examine public stigma towards people with a broad array of disorders, including adults with depression, schizophrenia, alcohol or drug dependency, and children with depression, ADHD, and oppositional defiant disorder. As people with mental and substance abuse disorders become aware of public stigma and of related discriminatory practices, they internalize the perceived stigma and apply it to themselves. The effect of self-stigma include lowered self-esteem, psychologically harmful feelings of embarrassment, and shame. Low self-esteem can lead to the why try effect, meaning why should a person try to live and work independently if he or she is not valued? Among people with mental and substance use disorders, low self-perception is associated with failure to pursue work or independent living. Targets for interventions to reduce public stigma include the general public, landlords, employers, healthcare providers, and groups within the criminal justice system. The corresponding interventions would be aimed at changing behaviors and interactions from discrimination, fear, neglect, and sometimes abuse to extending support, high-quality treatment, and equal opportunities for housing, employment, and personal success. Examples of such interventions include use of media for mass messaging to dispel myths regarding behavioral health disorders and treatment, education to counter the lack of knowledge about disorders and treatment, contact with people with behavioral disorders, and protest strategies against discrimination. Even with the confidentiality law in place, we see the real consequences of disclosure and practice every day. The reality is that there are few meaningful legal protections guarding against systemic discrimination towards people with substance use disorders. The Americans with Disabilities Act, which prohibits employers from acting adversely against employees or potential employees because of their disabilities, contains an exception for the current illegal drug use that effectively makes it legal for an employee to be fired or demoted for seeking treatment for a substance use disorder involving illegal use. Given the lack of other legal protections for people with a history of substance use disorder, protecting patients' right to consent prior to disclosure of their medical records is critical. What is needed to most effectively maximize access to substance use disorder treatment and promote recovery is legal protection from discrimination and criminal consequences, and coordinating care across both healthcare systems and social services systems, including criminal justice. Until this happens, there is a very real danger of serious negative consequences for people who disclose their history of substance use disorders. And consenting to provide this information to a clinician is an act of faith on the part of the patient. For clinicians to fulfill their oath to first do no harm, it is critical that they learn and acknowledge the risks that patients face when they disclose this information in order to truly deliver quality care while safeguarding their patients' trust, mostly by not discriminating against them. Because substance use disorders often first come to light in the context of school, law enforcement, and employment, communities have many opportunities to expand the delivery of prevention and treatment services to include school and school-based healthcare clinics, jails and prisons, and places of employment. Services provided in these settings can range from prevention education to treatment for substance use disorders. These efforts require a public health approach and the development of a comprehensive community infrastructure, which in turn requires coordination across federal, state, local, and tribal agencies. A number of states are developing promising approaches to address substance use in their communities, including a comprehensive strategy focused on strengthening prevention, creating more opportunities for intervening before problems become severe, integrating the identification and treatment of substance use disorders into healthcare reform efforts, expanding support for recovery, interrupting the cycle of substance use, crime, and incarceration, reducing trafficking, production, and sale of illegal drugs, and measuring the impact of various interventions.
A person who uses drugs looks like you and me. They don't look like anything. They look like people. They look like people who use drugs. They look like people who walk. They look like people who eat. So if you want to know what somebody who uses drugs looks like, look in the mirror. The drug war dehumanizes people in a way that allows all the rest of us to never see their humanity. Because our prison population says the people who use drugs are black and brown. And we know that people across the table use drugs at roughly the same rate. A Better Way Foundation was started by the Drug Policy Alliance in 1999. It's a great relationship for drug policy reform movement.